practice, we hope that we're going to be receiving from you and give us feedback about the Saudi morning show. Right now we are going to be moving to the topic of the day. We'll be talking about blood clotting, and we'll be knowing more about this important health issue that sweep away a lot of people's lives. Unfortunately, God forbid, this is not going to be happening to any of whom is watching us, and this is why we will try to raise more awareness about this and give you more idea about it. It takes us a pleasure to be welcoming Dr. Mohammed Al Sheef, the consultant of internal medicine and vascular medicine department of medicine. Welcome to the Saudi morning show, Dr. Mohammed.
Welcome. Good morning for you and for everybody.
Thank you. First, we'd like to know a general idea about the blood clotting, or how it could happen and where exactly in the body, as we are having an incarnate here in the studio that Dr. Mohammed will be giving us specific idea about it.
Yeah, the blood clot can be in the arteries or in the veins, arterial or venous, because we have venous and arterial circulation. The arterial clot, the stroke, which is in the cerebral arteries, or it could be in the heart, which we call coronary artery disease or heart attack or myocardial infarction, or it could be in the lower extremity, like we call it peripheral arterial disease. So this is the one side of the coin, which is arterial clots, which can lead to death or severe disability. Then we have on the other side of the coin the venous blood clot. Venous blood clots form in the veins. Veins, usually they carry blood from the, let's say, the legs or the tissues to the heart. So venous clot, it can be in vast majority of cases, like 95% of cases, the deep veins of the lower extremity. We call it deep vein thrombosis or blood clot of the leg veins. And it can detach part of the clot. It can detach or separate and move with circulation to the right side of the heart, then go to the pulmonary circulation. We call it pulmonary embolism. So they are pulmonary embolism and deep vein thrombosis, they can coexist with each other, or they can, because pulmonary embolism is a complication, is the most severe and feared complication of deep vein thrombosis. So this is like 95% of cases. This is the theme of our Awareness Day, that together against venous thromboembolism. Venous thromboembolism include the blood clot of the lower extremities and the pulmonary artery. So this is collectively called venous thromboembolism. That's why we use in our logo, it's a stop sign for VTE. Means we have to stop VTE as health care professional, patient, public. So this is a responsibility for everybody. This is the theme we have adopted. Then we can have we call rare venous clot, which occur in less than 5% of cases. It could be in the brain, we call it cerebral vein thrombosis, or it could be in the abdominal veins, like supplying, the viscera, like splenic vein thrombosis, or intestine, we call it mesenteric vein thrombosis, or the liver, hepatic or portal vein thrombosis, or the kidneys. So this is like rare, exceedingly rare compared to the, we call it the blood clot of the lower extremity or the lungs. So this is generally, including, but we have to reassure that people, once they hear clot, they relate this to death.
Exactly.
That's why in our Awareness Day, would like to raise awareness about the clot. It is a disease that can be prevented, it can be treated, effectively.
It's not eventually.
And prevent its complications. So this is the way that we want to relay message for our people. If even in our poster we use, if you can show you that we have a blood vessel, and it has clot. Clot usually formed by red blood cells, by the platelets, and by fibrin, which is a protein material. This is the end result of the coagulation cascade or coagulation blood clotting system. So what happens for the clot, the RBCs or red blood cells, they will turn to flowers, red flowers. So this is the way that, it's a novel way, it's a way that people they look at it, yes, clot, it's not fearful, it is not related to death, because it can be prevented, it can be treated effectively. I think everybody likes this notion or idea how we put the RBCs turn to be
Flowers.
red flowers.
Trying to be positive with people,
Sure.
so we change their ideas. But Dr. Mohammed, let me ask you about the causes for this.
Excellent.
Most people, this is the simple cause that I know. One of them, the lung flights.
Yes, long haul
Is that
flight,
one
yes.
of them?
Sure. I mean, causes could be, we call it acquired, or it could be genetic, okay? And there was a scientist before 100 years, his name Virchow. He invented, or he's the first one who bring up this, we call it Virchow triad. His name, triad, 3 limbs of triangle. First one, so usually the blood flow in the vein smoothly. So if you have any slowness or sluggishness or stasis, this is a medical term, blood flow, this will predispose to blood clots. Example, like if you have long haul flight, more than 8 hour, transatlantic trip, if you have hospitalization
Only for once, Dr. Mohammed, it could cause blood clot in limbs.
Yes.
I mean, even if I'm not traveling every now and then, so every summer or every year or something, I'm having this sort of long flight, I could be developing a blood clot?
Yes, if you have the what we call the genetic predisposition, you develop it. That's why the causes of clot are multifactorial. It's more than one cause. They interplay with each other. So the long haul flight, that it's one of the risk factor, especially if you have the genetic background. That's why always we say genetics load the gun and environment pulls the trigger, okay? So that's why we recommend people for long haul flight more than 8 hours to every 2 hours stand up, exercise, drinks a lot of water. So this is, or sometimes you use elastic compression stocking. This is a medical socks, okay, not the regular one. This is one of the cause. Another cause of slowness of the blood flow is hospitalization. If you are hospitalized
On the bed.
yes, in the bed, immobilization or immobility, this is again risk factor. That's why blood clot or pulmonary embolism is the #1 preventable cause of death among hospitalized patients. That's why we are again conducting or holding this awareness day. Remember, it's #1 preventable cause of death among hospitalized patients, and can be prevented simply by just following the guidelines, either by early ambulation or by using mechanical method like elastic compression stockings, or using pneumatic pressure pump, or using the pharmacological agent like the heparines. There are heparines, like low liquid heparin can be injected under the skin, so it can prevent the blood clot. So again, surgery is important cause of like immobilization, especially like if you have abdominal, let's say cancer surgery, orthopedic like hip fracture, knee, hip replacement. So this is one arm, which is you have stasis or slowness of blood flow. #2, remember the blood flow is continuously flowing. Just the velocity of blood flow or speed of blood flow is 48 cm per second, 48 centimeter per second. That's why if you have the blood clot that form in the deep veins,
Yes.
if detached and move with circulation, can go to the heart, then to the lung within fraction of second, because blood flow, as I mentioned, is rapidly flowing, 48 centimeter per second. So that's why if you have any slowness, this is #1. #2, if you have any injury to the vein, like if you are putting a catheter, okay, especially the central veins, okay, or if you have any surgery like orthopedic surgery, because usually they manipulate the veins. This is again another risk factor. So this is the vessel injury, because usually the vessels, there is a lining of the vessel in the vein, but it has to be intact. Any damage, it will cause or incite the blood clot formation. This is applicable more for arterial, because that's why the main cause of coronary artery disease is atherosclerosis, because the damage to the lining of blood vessel, we call it intima, because it will form lipid and again will hardening the
I
vessel.
think this is for more concern for physicians because patients, I think they will have nothing to do if their vessels are injured
Sure.
or so. This is more for physicians. Am I right?
Sure. This is. I mean, it's like it's a responsibility for everybody, but this is like
I know.
this is what we call acquired from hospitals, okay, or iatrogenic. This is a medical term. So this is
Yes.
like caused by physicians rather than by patient. The third one, which is we call it hypercoagulable state. I mean, blood components of blood. It is a fine balance scale of we call it clotting protein. Then we have natural anticoagulant. This is like against thrombosis. They can balance the blood.
Because
Subhanallah.
we need clotting.
Sure,
I mean, whenever
it's
we're
physiological.
injured,
Yes.
what happens is the clotting means that the blood just freezes on your skin, and you need this to prevent you from having any microbes to enter your body. So, in some cases, we need it.
Yes, this is just to go analogy, very nice. That's a blood clot formation is physiological. To stop bleeding, if we don't have this, phenomena or physiological process, we will die from bleeding because non-stop
Exactly.
bleeding. So we have to have blood clot formation. It is essential process, but in the meantime, you have to have what we call breaks for it, prevent it from continue to form. If you have, let's say, have a wound, then you have clot formation. It will stop the wound because we have in our body we call intrinsic or own, like dissolving the clot, preventing from its like propagation or extension or forming, clogging the vessel. So subhanallah, it is finely balanced so that there are protein S, protein C and antithylamine 3. These are essential to balance the blood clot formation. That's why some people, they have genetic defect or deficiency of the protein S and C, and usually they are what we call high risk for thrombosis. So there are three limbs of the triangle: blood flow, the vessel, the lining of the vessel. Then we have the constituents or components of the blood.
And
Okay.
Dr. Mohammed, if you could explain to us how the blood clots would move from the legs
Excellent.
and around
Excellent.
to the lungs and the heart.
Excellent. So if you allow me to
Yes.
explain, so these are the deep veins of the lower extremity. Remember, deep veins because they are inside the muscles, different from the superficial veins that are affected by what we call varicose veins. Varicose veins, they are under the surface of the skin. They can have clot, but it's not risky because it does not detach or move to the heart and to the lung. So usually it will cause some sort of inflammation, reddening, red, hard. It will be palpable like cord. This is people who have like what we call varicose veins. We are talking about
Most of the females, we have this.
definitely.
We know.
We are talking
Yeah.
about the veins inside the muscles. We call it deep veins. Okay, it's different. Once it formed below the knee, we call it distal. This is away from that. This is less risk to go to the lung. If it is above the knee, like here, the veins in the thigh, it can detach. So if you have, we call it proximal or near to the heart, this is higher risk of detachment, and we call it embolization. So more than
Means that
50%.
it could reach easier.
Yes, easier and it's closer, okay? So it can go from this and to the inferior vena cava, this is in the abdomen, then go to the right side of the heart, just to show you, okay, that the heart formed from 4 chambers, can go to the right atrium, right ventricle, then this one, this is the main pulmonary artery. In 10% of cases, it can occlude or obstruct the whole main pulmonary trunk. Cause death.
And this pulmonary
is-
trunk is the one that is responsible for spreading the blood all over
Sure.
the body.
This is
Okay.
So if it's closed, means that no blood's going to go
Sure.
to anywhere.
Yes,
So
we
we
have-
read the nerve.
Yes, we have venous systemic circulation and we have pulmonary circulation. This is the pulmonary circulation. If the blood is not flowing, the patient have shock. So this can cause death within 1 hour. And this is
Wow.
in 10% of cases. That's why prevention is better than cure.
True.
We can prevent this easily. And once you have it, if you diagnose early, you can prevent complication. Because this is important, depends on the size. That's why people, they ask, what's the relationship between the blood clot in the legs and blood clot in the pulmonary artery. So I hope I was clear in this regard. Okay, it can be small. See the one? It can be clothing this small veins. We call it distal. It's not proximal. I mean, excuse me, I'm using medical terms sometimes, but I'm trying my best to explain it in a plain language. Okay. So this is just regarding the venous thromboembolism, which can include both legs
So,
and
yeah, let's get to the important part,
Sure.
Doctor. And now we know the procedure and everything, but since we have an awareness day in these regards, and we've been talking about prevention, tell us about some of the major steps for prevention. You mentioned some in your discussion, but still, we need the list. Aspirin is one of them.
Sure.
The
Sure.
medical pills,
Sure.
physical exercise.
Sure.
What else?
Yeah, I mean, the objective of the awareness day and target audience is not only patients, inpatient or outpatient, even public and healthcare professional. So it is it's a group. Okay, we have to tackle it from different angles. So for healthcare professional, very important that remind them because about the importance of prevention of venous thromboembolism and treatment and diagnosis. For patient, this is a new for us, that patient involving patient. Imagine I'm a physician and I'm sure you have been visited, let's say your mother, your relative admitted physician is a human being, sometimes forget to implement or use the preventive measures. We want to raise the bar of the awareness. We want patient to share in the process. Just to remind a physician, doctor, am I at risk of developing blood clot? My relative at risk? If yes, what should be done? What treatment and for how long? So this is like it's moving forward rather than just to, because last year we have held this awareness day. This year we have, like every year we have new ideas, more involvement. So this is the
To be alert.
To be alert.
As a person, to be alert
Sure.
for your health, and even if you are in a hospital and under the safe hands of physicians, of course, but asking questions could be really good, and it could remind them
Sure.
of things that they
Yes.
might have missed.
Yes, of course. We should not underestimate the mind of our patient. They are now reading. They are now we have the media. It's this is the era of
They
technology.
can Google it while
They can
are
Google
in
it.
the hospital.
I think they're right. The physician should be ready, to answer any question. He should not be upset. This is their right to know about their disease. And believe me, sometimes they remind the physician. Sometimes they remind me something that overwhelmed with so many stuff in the clinic, you forget
So
it.
many cases.
Yes.
And,
You'll thank the patient, say thank you, reminded me about this. I'm glad, that the patient coming with a checklist. Doctor, what about this? What about aspirin? So usually I thank the patient, he's involved in the process of health care rather than just to be passive. Just now there is a term that we say it's paternalistic approach, like a father talking to the son. You have to do this. No, this is not the approach.
And it doesn't happen these days.
Yeah, the model is
now my
changed.
daughter tells me, Mom, do this and this and this.
So,
it's completely the opposite. Now kids are negotiating with
Sure,
parents.
this is what we want. They should be negotiating. So in addition to treatment, because remember the treatment for blood clot, we have like all generation of, blood thinner, and you have a new generation. The old generation that you have the aspirin, which is antiplatelet, you have the warfarin.
Okay, I have a question
Sure,
here,
go
Dr.
ahead.
Mohammed, please. People with a family history of having their moms or dads having sort of a blood clot or about to be having something or have a heart problem, which they could be also taking some of the medications that are anti-clotting as well.
Sure.
Some of those people, and I have read this, that after 40, the age 40, you should be taking 1 aspirin per day because you're having a family history, and this will prevent you from developing blood clot later on. Is this good or bad, as
Sure.
you talked about aspirin?
Sure, this question is not straightforward. This is a debate It's a question of debate, controversy. So now, if aspirin, which is like to prevent, let's say, heart attack, stroke, arterial stroke, and also venous clots, it's like a debatable question. But now it depends on your age, depends on the presence of other diseases. Let's say the age, if you don't have any other diseases, we call it comorbidity. Like after 40, recommended to use aspirin as a primary prevention to prevent clots. Okay, this is a primary prevention. Let's say somebody 40 but having diabetes, hypertension, high cholesterol, strong family history of heart attack at young age, this can use it at younger age. So it's not black and white. Sometimes there are gray zone cases, but really aspirin, because I'm specialized in blood clot, it is essential drug to prevent. Okay, that's some people. But there is the other side, that the anticoagulant or blood thinner, it's usually different from aspirin. Okay, but yes, more than 50, yes, it should be used.
More than 50.
But important, keep in mind always risk-benefit ratio. It's a scale.
Yes.
So if a patient having, let's say, past history of peptic ulcer disease or gastritis, inflammation of the stomach, and or bleeding from the intestine or stomach, he should not use aspirin. Okay, this is what we call contraindication. So if to be used, we can have other pills like Plavix. This is another antiplatelet, or you can use with anti-secretory pills to reduce the acidity of the stomach. Because the stomach is acidic. Okay.
What about exercising, doctor? Like having physical exercise,
Sure.
and having them as a routine, a daily routine for you.
Sure, very important. We say this is we call therapeutic lifestyle or healthy lifestyle. Is very important to prevent arterial and venous blood clot. When we say we call the lifestyle or healthy lifestyle, exercise or physical activity is very important. To minimum 30-minute brisk walking 5 times per week, or running 20 minutes 3 times per week, or use pedometer. We have talked in previous episode, 10,000 steps per day. So exercise is important, and ideal body weight. So obesity is again is a risk factor for arterial and venous clots. Number 3, that diet, balanced diet is very important. Smoking, yes, I'm coming to smoking. Smoking, that's why we invited in our awareness day the anti-tobacco program of Ministry of Health. See, that's why we have brought all people involved in blood clot, directly or indirectly. That's why some people ask me, why you invited this? I told her this is very essential. Okay, prevention is the cornerstone for our awareness day. So everybody was happy, so they are with us. So to raise the message that smoking is the risk factor for all kinds of clots, arterial and venous. So smoking, all kind of, smoking, whether it is water pipe, it's tobacco, cigarette, so all kind of tobacco product, alcohol consumption, and etc. Okay, so these are the main. Okay, this is, we call it modifiable risk factor. It means we can modify it, we can change it. But you have unmodifiable, like hereditary, okay, or genetics. Genetics, it's like we are born with it. So we can, sometimes somebody have protein S deficiency, which is, this is genetic, hereditary. Okay, hypercoagulable, or increase your risk of clot. But you can avoid blood clot if you modify your lifestyle to avoid, blood clots.
So we're talking about simple steps that could prevent us from having those blood clots, but we need to make people fully aware of this, and that's why, mashallah, you had a complete awareness day with different, as you invited some people to participate in this.
Yeah, I mean, for the awareness day that we have invited 17 departments, 17 departmments inside KFMC.
Exactly.
So that the patient will have, during his journey in the awareness day, will have all aspect about blood clot.
Full idea about what could happen. Dr. Mohammed, can I ask you about the symptoms? Symptoms that could put us into a red alert or alarm that I'm having something wrong with my legs. What could it be? Just pain, or swellness? What
Redness.
are
Redness, yeah. So the symptoms of the clot of the leg veins, so it can be swelling of the calf area, in addition to pain, and the pain more intense, more severe, and the what we call this one, the muscle, the gastrocnemius muscle, I don't know we call it, the calf muscle, yes, intense, in addition to have difficulty walking, and hotness, you feel it hot. So this is what we call signs of inflammation. This is important, should alert the patient to seek medical attention. That's why we want to raise to be, once you have the start of the symptoms, you should visit emergency physician, rather than, because if you can't present to emergency early, you can prevent the complication, which is detachment or separation of the clot and going to the lung. So this is important. Sometimes you can have veins, superficial veins or surface veins can be dilated, because you're obstructing the central veins or deep veins. You can have the blood can go to the surface veins.
And Dr. Mohammed, after visiting the physician, how you diagnose this?
Excellent. So this is the symptoms. In very important symptoms, we have to take in mind, we call the history, family history, personal history, previous clot. We call it risk factor. If you have presence of risk factor, so not anybody, we don't want anybody to be panic. So if you have the right clinical setup or the history and physical examination, family history, like taking female blood, we call it oral contraceptive pills. Again, we have to talk about this topic. If you're pregnant, it can increase the risk. If it is post-delivery, so you have to have history, examination, and the presence of risk factor. So how we diagnose it? We do just Doppler scan. It's ultrasound. Ultrasound the vein. It just compress the veins. It can be diagnosed quickly. Very simple. This is non-invasive. Nowadays, we are moving from to inject contrast to the veins. Now, this is very simple. It's ultrasound. This is for
quick, not painful. And
quick, non-painful. We
safe.
call it and safe. Yes.
And doctor, your final words before concluding, as we are running out of time.
Sure. So this is as I mentioned, this is regarding the deep vein system. If you identify it early,
yes,
we can prevent its complication, which is deadly, like pulmonary embolism. And remember that blood clot of the lung is the leading preventable cause of death among hospitalized patients, and can be prevented by using simple measure, but has very significant impact.
Yeah, Dr. Mohammed, we hope that the campaign is going to be successful and lots of awareness going to be raised, God willing. But I should ask you, the color of the dress, what is it?
I have seen it in my Instagram.
Yeah, so what's the color?
It's golden.
Wow.
Off-white and gold.
Yes.
Okay, thank you. Thank you so
So
much.
I'm the only one who's saying black and blue.
So yeah, it's 2 versus 1. Ghazi is saying black and blue. Dr. Mohammed Al Sheef, the consultant of internal medicine and vascular medicine department, thanks a lot for being here with us, and best wishes of a very successful campaign, God willing. Thank you.
It was a really great pleasure, and honored to be with you,
Thank you. Thank you so much. We are going to be stopping with a report. We'll be back with the Saudi Morning Show. Stay tuned.
Here is with me Dr. Mazen Al-Sahibani. Can you please, Doctor, tell me about this event?
Well, this event is about educating the public about venous thrombosis. It's the second event that we held. Last year we did one, and this is the second one. Okay. Yeah. So this is the second one. It's about educating the public about the preventions and how to prevent thrombosis and how to treat thrombosis as well.
what do you think is the dangerous, or how important is it gonna be for patients, and aware them as well?
Well, it's quite important. The more we educate, the more we prevent, and the less we're going to see of thrombosis. So our aim is for the public to be aware of what are the risks and how to prevent the thrombosis. So they have to keep mobilizing all the time in the airplane, after surgery, and so on. Weight loss, kind of food, everything that can decrease the chance of developing thrombosis.
Is there any main thing that cause clot?
Well, we can't point our finger at one certain thing, but it's a multiple factors that come together which put the patient at a higher risk.
Welcome back. And such health events are so important to raise awareness and let people know more about things that we had no idea about before. As we've been having our guest, Dr. Mohammed Al Sheef, and he told us that patients now should be more alert than before. You should be asking questions to your physicians as a patient, God forbid, or as a relative of anyone who is at a hospital. You should be raising whatever issue you have. This is my advice all the time. Even if you're not at a hospital, whatever you want to ask about or say, just go for it.
Yeah, true. It was a very informative discussion with Dr. Mohammed Al Sheef. Honestly, he explained everything in details and how to prevent having blood clots. May Allah, inshallah, help us in the prevention. And for now, dear viewers, it's time to move to some of the funny cartoons. The previous ones were the ones with the message. Those ones are funny ones. We'll see them and we'll be back to you. Stay with us.
Welcome back, funny cartoons, and you're still watching the Saudi Morning Show. We've been talking about blood clotting and how important is it to keep moving, keep yourself in motion all the time. This is going to prevent you from lots of health hazards, God